Hey guys, welcome to our monthly movement tip. I'm Dr. Charles with RX Physical Therapy in Wayne, New Jersey, and today I'm going to give you a progression of exercises that you can use if you've been dealing with some shoulder pain. So there's two categories that we're going to go over today, all right? So two main reasons why people's shoulders hurt, and they really don't have to do with the shoulder joint themselves. So the first thing that we see is a lot of stiffness through people's rib cage, and the second thing is a loss of control through your shoulder blades, all right? And those two things are going to change how the shoulder joint moves and can result in a little bit of pain. So we're going to go through 4 exercises today, 2 for each of those things, and you're going to see if you're feeling better when you finish. Our first exercise is an assisted thoracic rotation. So you're going to have a band hooked up to a squat rack. The band is going to assist you, so you're going to put it on like a jacket, and then drop down onto your hands and knees and have your elbows on the ground. All right, the shoulder that has the band wrapped around it, you're going to take that hand, put it behind, and you're going to rotate your elbow up to the ceiling, and you're going to let the band pull a little bit of overpressure so you get a deeper stretch, and then come back. You can time your breathing up with this to get a deeper stretch, so you can inhale when you're at the bottom, and as you rotate open, exhale. If you feel one side's a little stiffer than the other, you can do a few more reps on that side to even out. The next drill is going to be in a little bit more challenging position. So you're going to have your outside knee down, and you're going to have your inside hip and knee pressed up against a wall. You're going to have both hands out in front of you and turn your palm to the wall. You're going to rotate open, make a big rainbow with your hand, and turn your chest and your nose towards the wall. And then you're going to come back. When you do this, you want to make sure that you're not leaning away from the wall, and you want to keep your spine as upright as possible and your side as close to the wall as you can while you're doing this. You should feel the stretch in your upper back between your shoulder blades. And just like the last one, if you feel like one side's a little stiffer, you can do a few more reps there. Your next drill is going to focus on teaching your shoulder blade how to stabilize itself. So again, we're going to use a band hooked to the rig. This time you're going to have it behind your shoulder blade, and it's going to give your shoulder a little bit of feedback of how your shoulder should be moving and how your shoulder blade can stabilize itself. So you're going to have one knee down. You're going to use the same knee as the shoulder that has the band. You're going to pinch your shoulder blade back and just try to reach up to the ceiling, trying to get your bicep behind your ear and back down. When you're doing this, you want to make sure that you're not arching through your back. You want to keep your ribs down and your butt squeezed. All right? Try not to let the band fall down your arm. This way your shoulder blade knows that it's working. For the last drill in your shoulder series, you're going to use a mini band. You're still going to have one knee down, and you're going to have the band wrapped around the back of your shoulder. You're going to loop your thumb through the front of the band, and same thing as before, you're going to keep your rib cage down, you're going to keep your butt squeezed tight, and you're going to pull your shoulder blade back. You're going to punch out forward and back in without letting the band roll down your arm as you do it. All right? If the band rolls down your arm, you're not keeping your shoulder blade in the right spot, and you're not going to be able to be successful with the drill. So keep your shoulder blade tucked back, punch out, and back in. This is going to be especially good for people who have a tough time or pain when they're doing push-ups or bench press or dumbbell presses. So just like before, if you feel like one arm is having a more challenging time, you can do a few more reps on that side to try and even things out. So there you have it. You got 4 exercises that can address your shoulder pain, 2 to address your ribcage mobility, 2 to address your scapular control, and you want to make sure that you do them in the order that we presented them today. So you want to do your ribcage mobility stuff before you do your scapular control, because one is going to influence the other. And if you've given these exercises a try and you're still dealing with some shoulder pain and you want to find a way to get over that shoulder pain and see what the next steps are, you can feel free to reach out to us via email at info@gorxpt.com, or you can give us a call, shoot us a text message at 973-542-4068, or shoot us a DM on Instagram at RX_physical_therapy.